Hello everyone, myself Dr. Samir. So today I am going to speak about water treatment, a class next in the series of the hemodialysis. My previous class was about the dialysate fluid. So now I am going to talk about the water treatment. What we learned in the dialysate class was that your salts is mixed with the RO water to get the dialysate solution. So this RO water we need that is a reverse osmosis water. The water that comes in the pipeline and that's into the hospital that is supplied by the municipality has many impurities and salt in it. So that cannot be used because those will cause infection or may cause salt deposits in the dialyzer or in the dialysis machine, and that may lead to several complications. So to prevent that, we use the RO water plant or the reverse osmosis water. So we'll see how is the water treatment done. So as I told, there are several salts present, the heavy metals present in the municipality plant. There are chloride treatment has been done, chloride salts are there. So that can damage the kidneys further. So that is why we need a RO water that is devoid of any salt or impurities or infection. Okay. So water treatment is necessary of the municipality water before it is used to get diluted with the your salts. Okay, for creating the dialysate fluid. So the water purification has basically three parts. Okay, so the pre-treatment part, your primary purification part, and the distribution part. Okay, so coming to the pre-treatment part, there is a mixing of hot and cold water to get a fluid of the desired temperature. Okay, so this is your again a pre-filter before the softener. Okay, the water, the mixing of hot and cold water is done of the municipality to get a desired temperature of water that goes into the pre-filter. This blocks any particulate matter that is present in the water. Then it goes to the softener. Now the function of the softener is to remove calcium and magnesium. I'll say in detail later. Then it goes to your activated carbon. There are two of these numbers of this activated carbon. So coming to the pre-treatment part, as I told you here, in the pre-treatment, first there is filter, a pre-filter, then a softener. So coming to the softener, here what happens that the calcium and magnesium salts that are present in the municipality water that is supplied to the hospital, they are removed in this softener by ion exchange. And ion exchange with whom? There are some resin beads present in this softener that contains sodium. So calcium and magnesium is removed from the treatment plant. The problem with calcium and magnesium is that when they go ahead, they may get deposited in the RO membrane and cause blocking of this membrane or damage of the RO membrane. That will hinder the purification of the water or water treatment. So here the calcium magnesium exchange takes place with sodium resin beads. Okay, there are resin beads in this. After that, from the softener, the water goes to the activated carbon filter. There are two in number, they are in series. So what happens is here that there is removal of chloride and chloramine compounds. Like there is chlorine treatment or chloramine treatment given to the water by the municipality before supplying it to the household or the hospital. So again, this chlorine and chloramine can also damage your RO membrane. So to prevent that, your activated carbon is used to remove the chloride and chloramine compounds. Sometimes what happens when the chlorine is unavailable, the municipality generally uses chloramine to remove the impurities, to treat the water. So these chloramine compounds, they take more time than chlorine to be absorbed from the carbon treatment. So that is why two are there in series, so that more of the chloramine can be removed. So the side effect of chloramine is that whenever municipality have gone for chloramine treatment instead of chlorine, and there is gradual the carbon filter gradually wears off because of subsequent use, there are chances that chloramine may go into the patient's tissues, in the patient system or into the patient, and that can cause hemolytic anemia. So it is a side effect of chloramine present in the municipality water. So that is why there are two filters in series. Okay, so that if one of them gets exhausted or wears off, we can, even the second one will help in removing the chloramine, and we can by that time add a new carbon, activated carbon. So this was pre-treatment. Now coming to the primary purification. So again, primary purification, there is a filter before the RO membrane. Okay, that filter is generally used to remove whatever carbon particles have escaped. As I said, the water before this step comes from the carbon bed, activated carbon bed, and resin beads are present in the softener. So there are chances of leak of carbon particles and resin beads into the water. So in the step of primary purification, in the pre-filter, this is first removed, the carbon particles and resin beads. Then we go into the RO membrane. Now RO is a semi-permeable membrane. What happens here is the water that has been pre-treated is goes through this membrane with a high pressure. This high pressure, when it passes through this membrane, causes the filtration. So there is a high pressure filtration through a semi-permeable membrane. Now this membrane hold back the solute, whatever remaining is present, it is hold back. So the contaminants, like I said, carbon or resin beads, and it also the bacteria is inhibited or killed before going into the going through the your semi-permeable membrane. Then your next step is your ionization. Then it goes to the ultrafiltrate. Ultrafiltration is done, that reduces the contaminants. Okay, so these contaminants can also be removed by UV rays. Some centers may choose UV rays to remove this bacterial contamination. Okay, so then we go into the distribution. So in the primary purification, first there is a pre-filter, then there is a RO membrane, the semi-permeable membrane, which is the where the reverse osmosis takes place. The solutes are held back and the water goes in, comes out to the other side of the membrane. Then it goes into the ionization, then ultrafilter or UV rays. So that is the complete primary purification. Then it goes for the distribution. Now we see that the pipeline, the RO water in the dialysis machine class, we saw that RO water used to come from a pipeline into the machine. So that pipeline, it is, we can see a schematic diagram here. So there are 3 dialysis machine for descriptive purpose. There can be any number of, there are many ports. This is your water coming out of the ultrafilter and then being supplied to the machines. The piping system has to be leak proof. They have to be regularly disinfected. There should be minimal breaks possible, and there should be no dead end. There are guidelines that has to be followed to maintain this pipeline system, and regular checks has to be done, and disinfection also has to be done, and proper documentation of the disinfection, and there are guidelines to be followed to maintain the purification or the purity of the RO water. Okay, proper documentation and guidelines has to be followed. Now coming to water treatment for home dialysis machines. There are some home dialysis centers, although not very common in India. It is available at some places but not very common in India. But for home filter, what is done? There is a sediment filter, then there is disinfection by the UV rays, then there is a carbon filter, then there is an ionizer, resins, as we saw in the previous slides. There is a resin that is for softener. Okay, the sodium containing resin that removes your calcium and magnesium. So there is the resin that removes electrolytes. Then there is a backup resin, the third one we see, that is a backup resin. Then comes a filter to remove bacteria as small as 0.2 microns. Okay, so this is how the basic RO water is delivered to the dialysis machine. This is the water purification process. Thank you.